Radioisotopes. What are radioisotopes? Well, radioisotopes are basically isotopes that are radioactive. Isotopes are atoms whereby the number of neutrons does not equal the number of protons. This inequality impairs the reflex force, which in turn causes instability in the nucleus and the emission of radiation, hence the name radioisotope. A good example of a radioisotope is iodine-131, also known as radioiodine. Iodine-131 has a half-life of 8 days. This is the measure of time it takes for a particular mass of a radioisotope to lose precisely half of its mass. Iodine is a liquid element and has an atomic number of 53. It is symbolized on the periodic table as the letter I. Iodine-131 consists of 4 additional neutrons, making the nucleus unstable and producing radioactive energy. About 10% of iodine-131's energy is through gamma radiation, but it dominantly produces beta radiation. Iodine is extensively and dominantly used in medicine rather than industry. It is used for both radioactive and non-radioactive cases. A therapeutic practice of iodine-131 includes nuclear medicine and is occasionally seen with diagnostic scanners. It is primarily used to study the functioning of the thyroid. However, major uses also include the treatment of hypothyroidism. In some instances, stronger doses of iodine-131 are used in radiation therapy, where tissue obliteration is required, such as thyroid cancer. The benefits of using iodine-131 are that it eradicates the need for surgery. Iodine is designed to eliminate the thyroid without the need for surgical impediments. Iodine also has the ability to act as a catalyst for metabolism. The thyroid gland uses iodine to produce distinct hormones for metabolism. Since iodine is only used for one organ in the human body, it makes it easier for doctors to observe the operation of an ailing thyroid, as stated before. Also, iodine-131 has a very short half-life, which means it decays almost completely in the environment within months. On the negative side, iodine-131 is used in radiotherapy, and radiotherapy is never completely good for a human, as it involves radiation. And ultimately, like all other radioisotopes, iodine-131 may produce dangerous levels of ionizing radiation. The radioactivity inside a human can set off a radioactive monitor. Even though iodine-131 has a short half-life, it will remain radioactive for months after its use. It is evident that iodine-131 holds more benefits than problems. In fact, there are very few problems that occur when using this radioisotope. And in terms of thyroid cancer, it is more likely that the cancerous cells will be completely diminished rather than the cancer reappearing elsewhere.